This is the overview of your population-focused design project rubrics. So we're taking all the authoritative, or most of the authoritative bodies, and we're taking that information and we're applying that to your leadership practice. So the fundamental concept behind the design project is to serve as a proposal to your leaders, your administration, or your area of practice or practicum to actually implement the project. So you're going to be doing a project based on your risk analysis, and from that you've prioritized, and from the priority you're going to actually apply the evidence in practice to elevate population health outcomes for a particular population. So that's the underpinning of this entire assignment, is really putting everything together. And we're going to pull from some of the materials that you may have actually done in your previous coursework, including your SWOT analysis, your strategic plan. We're going to look at informatics. We're going to look at concepts such as health literacy, cultural humility, possibly looking at policy, and maybe even correlating with your DNP project as well. So we're really taking that very broad view to design a very tangible and meaningful project for your area of focus. So there are specific instructions on thinking about how to position yourself for the formal presentation, your proposal. So you are going to actually use some of the readings from from the course and integrate that into how you're going to design your project. And part of it is doing a logic model similar to what you'll find in Cup and Curly's. That's what the basis is for your textbook. So that's within chapter 7, so keep that in mind, because that will be very helpful for you as you complete this project. So we're going to start out with just the basics of presentations and establishing your SMART objectives, and really looking at an overview of the population health practice, just kind of a broad view. And then we're going to dive into the why behind your project, and that will be substantiated by the findings that you had in your epidemiology risk assessment. And then we're going to dive into the what, specifically the program or intervention that you are proposing. So you need to have very broad considerations when you're looking at applying a particular intervention. And sometimes it's what the community is ready for or what the population is ready for. Basically, it may not be specifically what one would deem as the very, very top priority, but it's something that's doable and feasible. So again, we want to make sure that we use our resources in a very productive way and not push things that may not work in practice. So again, flipping way back to epidemiology, we're looking at something that will be effective for your population, and that reflects the wisdom that you apply as a leader in discerning what is the most effective program for your given identification of a health issue or health improvement, those types of things. So we want to make sure that we devise a timeline for the project, a proposed timeline, who's involved. And again, that's a key component of any kind of collaborative effort, is really engaging those who are involved and engaging in that shared mission and vision for a particular project, and having that mutual benefit, that there's benefits out there for those who are involved as well. So where are you going to do your program? How are you going to do some of the key factors in a project? So you're touching on those key components of the logic model when you're doing your presentation. And again, you want to have the stance that this is to engage leadership in approving a particular project. So then you'll go into a summary as far as the logic model that you've devised and review the problem, those types of things. So just follow the rubric, and I do suggest that you use the rubric as a checklist as you're completing your assignment. So we want to make sure that we're doing professional presentations, using professional concepts as far as PowerPoints, not too wordy of slides, those types of things. And also make sure that you cite your slides if you use PowerPoint to show where the foundation is or where the literature came from as you're doing your presentation, because again, that adds credibility to your presentation as well. So if you have any questions or concerns about doing your presentation, your project, please let me know. But I look forward to seeing what you come up with and how you're truly going to make a difference in your area of focus or population as you move forward. Take care now.